Hello, my name is Adine Mwizerineza and I'm going to talk about different career paths that are available in healthcare. First of all, in healthcare, there are two different paths that one can take. So the first is clinical and another one is non-clinical. So clinical career is working directly with the patients, such as making surgeries or anesthesia, while non-clinical career consists of doing other jobs that has a link with healthcare but not in a direct contact with patients. So I'm going to give three examples of non-clinical careers. The first is health information managers and technicians. So health information managers are there to manage the flow of medical reports and other information. Although they don't normally interact with patients, but they must also have knowledge such as medical terminology, medical law, and even medical coding systems as they deal with technical issues. Another example of non-clinical career is medical transcriptionists. Those are there to record patients' histories and clinical information. The knowledge that they are required is, for instance, medical terminology and language and writing skills to transfer abbreviated and simplified note taking into usable information for medical files. So you can see that they are also not directly connected with the patients. Another one is healthcare administrators. Mm, a healthcare administrator oversees the organization and flow of a healthcare office or project. So he is there to manage financially the staff, to coordinate, to plan projects, and even to set some policies and procedure implementations. So they must have different skills such as understanding finance, such as business organization, law, and ethics, even which are related to healthcare settings. So after now seeing those and clinical career examples, I'm now going to show a difference between to talk about licensed practical nurses, registered nurses, and nurse practitioners. First of all, the licensed practical nurses provide basic nursing care and they work under the direction of registered nurses and doctors. They work in many settings, including nursing homes and extended care facilities, hospitals, physicians' offices, and private homes. Most of them work in full time. They must have education. Their education should be they should be licensed. They must complete a state-approved educational program, which typically takes about 1 year to complete. They must also be licensed. Registered nurses perform physical exams and health histories. They provide health promotion, counseling, and education. They give some medications, they care about wounds and numerous personalized interventions. They also interpret patient information and make critical decisions about needed actions. They coordinate care in collaboration with a wide array of healthcare professionals, and they direct and supervise care delivered by other healthcare personnel like licensed practical nurses, as I said above. So they also conduct research in support of good practice and patient outcomes. So in order to do this, they should have a diploma or associate or bachelor's degree in nursing. The last one are practitioners. They do diagnosing, they treat, they help patients manage acute and chronic illness. They conduct physical examinations and interpreting medical history. They order and perform diagnostic tests and procedures. They prescribe physical therapy and rehabilitation. They provide prenatal care, family planning services, and screening services. They perform minor surgeries and procedures, they counsel and educate patients about preventive measures to avoid illness. So in order to do this, the minimum level of education is Master of Science in Nursing. So I'm going now to continue with allied health. Allied health is the part of the healthcare field that delivers services involving the identification, evaluation, and prevention of diseases and disorders, dietary and nutrition services, and rehabilitation and health systems management. So I'm going to give examples of 6 different fields in allied health. The first example of allied health is radiography. Radiography consists of using X-rays to visualize some internal parts of the body. An example is dental hygiene. As mentioned, dental hygiene, preservation of oral health. For instance, the teeth can decay or get other problems, and dental hygiene is there to solve all those issues. Dietetics is like a branch of knowledge concerned with the diet on the health of someone. Respiratory therapy is consists of handling problems of respiratory systems and such as failing to breathe. And speech language pathology deals with evaluation, diagnosis, and treatment of communication disorder and voice disorder and even swallowing disorders or difficulties. Physical therapy or treatment by diseases, injury, or disability, and even physical modalities such as massage and electrotherapy. The patient are educated to take care of their physical parts and they are trained to do so.